COVID-19, I hope each and every single aerosol containing all the freaking viral particles, your RNA shells, and the protein body that encapsulates it, I hope it all freezes so that we can send this virus flying. But to do that, we need to exercise some restraint and logic and think really about the long-term repercussions of certain decisions we will be making. Okay, and so this is basically still a poker channel. So the poker content that we're going to cover today is that the entire world's RNG is rigged right now. It's not just Spartan poker; it's the entire world. So that makes this poker content. And now let's think a little bit about math as well. It'll help us, with future endeavors. Math never hurt anyone. Neither did self-isolation. Like, it's kind of like the opposite though is happening, because it was a friend of mine in the UK who I heard saying something, and then now I'm seeing a lot of friends in India also echoing the same sentiment. So let's just work on a little bit of math and understand what we're facing, because we don't really understand what we're facing here, except for the certain very basic facts that it is a mRNA virus, which is actually pretty bad, because mRNA viruses mean, or just RNA viruses in general, mean that they're only a couple steps from cleaving your cell body. There are double helix viruses. We live in a cloud of viruses. We thrive in within viruses that are all around us. Some just pass through us. They don't cause disease in us. Understand where the disease in COVID-19 comes from, and the risks of opening up too soon when it comes to our economy, and how to go about it, pretty much in a very sort of game theoretic GTO sort of situation here. Okay, so first of all, let's just look at this. Okay, this is a very good source for information. It's funny that India was somewhere where is India? Oh, there it is. Well, we were behind a lot of these countries, man. We were behind. In terms of behind, I mean that means ahead. We didn't have that many cases. We were behind Pakistan. We were behind Norway at one point. I remember, like, it used to take a couple scrolls down before you got to India, and it was not, basically situation where I think this is underreported, because we are not encouraging, or our duty right now as citizens should be to self-isolate and to encourage our government to ramp up testing. That should be what our as citizens, what we should be thinking about. However, it doesn't hurt to understand certain of these models that are being predicted, how they work, what this curve is. This is not a graph, it's a curve. So let's look at India. And there's certain things that you will see here. Like, you see this right here. This is about this right here, I think, is the date where that unfortunate event happened, where people congregated in northern or southern Delhi, close to where I live. But you can see there has been some kind of, you can see this curve, and this is a logarithmic curve though, and this is the exponential curve. Now, and daily cases, you can see that there was a spike, and we've had 2 days of the record-breaking cases. Again, I think there's just not enough testing being done, but we need to see a decent trend of this curve flattening. Now, remember, we're not like fully exponential, but this is quite close. So again, we can restart our economy. We can take the outlook of we're suffering and let's restart so things get better. Um, However, the problem is that it should be looked at the other way around, where we should suffer this pain of isolation, self-isolation, stalled economy a little bit longer, so that we have no long-term catastrophe. Because in the short term, using the word catastrophe for having say 2 more weeks of isolation, or like having some arbitrary number that is optimized by someone to think that that would be the you know right way of increasing certain economic activity. It's all hearsay unless you can provide some data. If you do want to get some data, I would highly recommend This Week in Virology. I have basically devoured all their episodes, understood how viruses work, and let me shed some light onto the math and also the virology of stuff like hydrochloroquine, which all of us Indians were somewhat very proud of from what I saw on Twitter. People were talking about how we just got like a one up on the FDA and stuff. The drug is just horrible. Don't take it. It's gonna kill you. It's gonna have heart problems for you. Again, this is also that time where that big this little like thing right here is that day where that huge congregation was found, and that's a pretty unfortunate thing. And yes, self isolation in India is somewhat oxymoronic when you think about the markets being flooded. But again, if he can keep enough people still self-isolated and see the countries that are bouncing back somewhat, yes, people talk about the second wave, whatever, then there will be some herd immunity. But that does, for example, for vaccines, you need about 90% of community to be exposed to the virus for herd immunity to develop, which significantly renders the rate of infection ineffective. And that's what we as citizens can do. So 2 things we can do, first of all, is we can ask and just be relentless towards the government, to the government man, to ramp up testing, because we really need to. This will give us insight into contact tracing, where we need to go do contact tracing. It will just be give us a much better picture of where we are. So like the proper testing. There was some issues with kits from China. We already know our medical community for all of its all of the great doctors that we have in India and abroad. There's a lot of research and development that is essentially just for namesake. I've seen some of these facilities. I've seen some of the manufacturing base, public government manufacturing base facilities. They're all just swatting flies there. They're not doing actually any kind of research, and neither is India. We cannot be high-fiving each other because one of our drugs, which is not even ours, we didn't invent it. It's a World War I or II drug, hydrochloroquine. It just happened. We just happened to have a lot of it because we had a lot of malaria. So testing, and also like the integrity of this testing, and like being transparent. I love the person who drives around with that coronavirus car, because nothing will like actually like get it into someone's mind that there is this virus in town, right? All the leading scientists are still recommending staying at home. Yes, it's not only India. It's Italy has lost a generation of we consider our elders in our families some the linchpin of keeping of families. Like Italy has just lost a generation of them because they were not ready. It just hit them, and one of the reasons is that it was Chinese travel time because of their New Year's, and they don't really come to India. They go Europe and other places. So we were lucky in that situation, but I still think our cases are underreported because of lack of testing. So we can ask the government man to do this. We can also not actually fund the PMO fund and actually give money to NGOs who can provide food and other, whatever the NGOs are doing, whichever sort of framework their missions are on, help them. We should also stir our private sector manufacturing base to basically, you know, make us more masks that are actually worth it, not the ones that we see out there. They're not going to work. It's just basic physics. Okay, it's basically size. Like a filter needs to have a certain size, right? If the filters have this big of a hole and the virus is only this big in aerosols, I mean, it's just ineffective to actually wear one. If not actually worse for you. So remember, it's aerosols. So when you go into a bathroom right after someone else is gone in a public bathroom, remember when they have flushed the toilet, and this has a some rate of infection through fecal matter through the GI tract, because this virus is rather sturdy and it can get past not just the upper respiratory um, 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 proteins that it can bind to, but it can actually get into your GI tract as well. So whenever they have someone flushes, they just spread a bunch of aerosols in the air. So take your time, take 5 minutes before you go in. Remember these kind of things. Now let's talk a little bit about why we can do this. I know companies like Fanuc who do make automatic, like they're a robotic company, but they do make machines that do make medical grade products. And any kind of deficiency that we have in PPE or other equipment for our frontline. Like, I know a lot of war words or war terminology is used for our healthcare providers and people who are in ICU units risking their own safety. We should be critical of that. We should not think about the economy right now, simply because if we open too fast, not knowing the virology of this COVID SARS, like basically how does it actually lead to our immune system mal adaptation of our immune system and leading to pneumonia. It is definitely not anything like the flu, because the flu has a antigenic drift and an antigenic shift. These are the two ways it mutates, and that's why we need a new flu shot, or we get basically a flu every year, because it does have a certain amount of mutation. Now we also hear in the news that this virus is like mutating. Yes, we want this virus to mutate because this virus is actually pretty stable. It's pretty good at what it does, which is infect people. And yes, it's mild. However, we do not have any cure for it. We hardly, in India at least, we are dependent on other countries doing research, because we can't even develop our own kits for testing. So again, testing is hugely important. We should be pushing for this while we're sitting at home. If you think about the epiphenomena of people who have the means and have the money, who are sitting at home and have the luxury of ordering from Amazon and all that stuff, I mean, there's still, like, Amazon will not deliver without actually you paying up. So no pay on delivery. So they're also social distancing. They're practicing. You go to any shop, you see a chemist, you see 24/7, you see how we have to line up, and they keep continually using disinfectants and not injecting them, because at least we don't have, I don't like our prime minister, but at least we don't have that level of ineptitude in our leadership. Although that's something, I think that's a product of how vulnerable in our country is in terms of what can happen potentially and how little testing has happened. So yes, there will be some pain in the short term if we have to stick around without opening much, because there is no optimal, like, open this percentage of the economy and that will be optimal, open this much transportation. Why? How? What? Like, we don't know whether that's going to work or not. That's going to be risky. That's going to be really, really risky, and actually get us back to an increasing number of cases, and potentially be lethal for a lot more people. Now, a lot of people also have a problem with this fact that when it comes to flattening this curve, which is a exponential curve, right? That when we do flatten it at any point, so this is t time, and this is some function of, say, health facilities that can, or you can say beds per patient. or any kind of all of these functions together. And this is that graph of like y-axis and x-axis are here, with this being time and this being this, some function of the limit of health facilities we have. So first of all, we do not want this curve to go up beyond this upper limit of what we have as facilities. Then that would have, right now there's no what do you call it, elective surgeries and stuff. They're stopped because you have people in danger, and there's an outbreak and it's draining resources. So that's why this curve needs to be flattened. But we need to understand what that really means, because when we say we need to flatten this curve, it literally, so this is say like, number of people affected, and also a factor of like where our health facilities are in terms of their capacity. I know in India a lot of BS happens with the first case, the news that we heard with them having to like with no hospital being prepared to take them. That was pretty shitty. Those things will happen. If you compare this to like driving and how we have a system for driving and we let that go, well, driving is not infectious. Someone honking behind you will not kill you, will not infect you. Yet even with this infrastructure and knowledge of driving and cars, we still get into accidents. The two are absolutely not comparable. Okay, this is something we have no idea about when it comes to the COVID virus, right? We know it's actually a RNA virus, which means COVID SARS. It's a virus that only is a couple of steps away from cleaving through your epithelial cell wall. So this is the point at which we really begin to see a flattening of the curve. Now a lot of people will say like, okay, well, by the time it reaches, the number of people who actually get infected will probably be the same. But what they forget is whatever is the number of people infected here, and then the rest that get infected over time will be, and let's say this is T dash, and it kind of converges to 0 around T double dash. So in this time period, more people will get infected about the same, the R naught, and I'll talk about this and how to render. The only way we know, when we don't have a cure for the disease, we do not know the virology of it. We depended on hydrochloroquine, which has absolutely no virology. It's a drug that just increases the pH of your cells, makes harder for viruses to actually be in your system, but it seems to not be working because it was an anecdotal, no control test, which in terms of science is basically not science. We need to come back to forensic reasoning, deductive reasoning, and not be opinionated. Yes, we can have a perspective because perspectives differ. There's a statue here. You can look at it from these two angles, like this person and this person, and there's can be couple or one person looking at it from this angle. We can have different perspectives on it, but we cannot ignore the fact that there's something we are observing, and that's a fact. Okay, if you say it's 15 degrees today and I say it's 20 degrees, it's also a point of view. It's a perspective. To say that, to lay an opinion on how to deal with this and what is optimal, how much should be open, and the suffering right now versus long term, you have to realize that suffering a little bit now and rendering this useless right now, the only way we can do that is through rendering the vectors of transmission, which are basically human beings, right? So what does that mean? That means just not interacting with anyone, which is kind of like herd immunity. What is herd immunity? Basically, you've got these people right here, you've got someone here, and someone, like not that many, but like these guys have immunity, and then you've got like people here, and they don't. And because of this, some kind of like herd immunity, like because if this guy transfers to this guy, he's already or she's already immune or has some antibodies, which by the way right now we're finding out that the antibodies for people who have been infected doesn't mean that those antibodies are actually lasting that long in your bloodstream, in your white blood cells. But to get this herd immunity is basically kind of like social distancing. So if there's another way, which is that if I sneeze or if I have the COVID virus, I cannot sneeze a mile away to someone. I can't even sneeze downstairs to my parents who are both old, right? So that renders this ineffective, because this is a very important aspect, and it's the rate, not the rate of mortality, it's the rate of infectiousness or rate of spread. It's a non-zero positive number. And when that's the case, that's where you come up with this exponential curve, because this is just a constant, positive constant, like R naught times whatever the function of this pandemic is, f of p. And this is an unbounded function, so it's going to blow up to infinity. It's not going to converge unless we turn this exponential curve into what is known as an S-curve, sigmoid curve, logistics curve, whatever you want to call it. But this is the inflection point. Now, this is reached through right now measures we're taking. And what happens is, if we delay this, or if we open up and risk certain things, like, more people start getting sick and then we are in a lockdown for longer, that's one thing. But the other is that if we don't do what we can do, which is social distancing, and get on the government's nerve for testing, provide to the right people the money that is needed for the people who are suffering the most, have the manufacturing base be making for the government. We're not like America, where our healthcare system is way too private, so we can have the manufacturing base directly be making equipment that they supply to the government, that is then distributed to hospitals that do have quarantine wards, and also this PMO fund or whatever. And then whatever stimulus package that our government has or should have had, if in this sort of scenario, well, we'll see about that. But right now, I think testing, social distancing, and pushing the right people, and pushing the right sort of things that need to happen, like testing, providing to the right sort of organizations, not to banks who, when you see pictures of banks with those mobile ATMs and the vans and the security guard, all those people that they're renting, who's going to bear the cost for that? All that little money that they have to spend is going to get, not only are these banks going to get like, a pat on the back kind of thing, all the extra charges that they incurred, they're going to push into our savings accounts and hit us with charges that we don't see coming. Coming back to this curve though, right here, finally. So yeah, when we talk about antibodies and all that stuff, we have to realize that these antibodies are not lasting that much in the plasma of patients who have recovered. Now, obviously, that's the situation where we find new things about what's happening with this pandemic. And really, like, I haven't seen a single scientist who would disagree with what I have just said. I have seen a lot of people, including leaders, like dumb leaders of some very developed countries, spew utter bullshit, which seems to now be pervasive in some of our communities as well. And I don't blame the people. I think there's way too much media hype about what happens. People actually don't want this to are worried that this is mutating. If a virus like a SARS virus, if it mutates, it's very good for us. It's very stable right now. If it mutates, then it's more likely to just mutate into a form which is going to be unstable. And that's really good for us. We hope that it mutates. Every virologist will say this to you. Then you listen to things like This Week in Virology, and you will realize that there's a aspect of physiology here, which is what the disease does to our body. There's an aspect of immunology. Immunologists have a different perspective as to why it's going for the AH6 and the PI6, and the I don't know if these are the proteins that it's binding to, but then the what is that? It starts with a C. I'm not a medical expert, so I'm not going to try to cytokine response. This is very important in terms of like what leads to pneumonia. You don't want a huge cytokine response. You want to also not exercise that much. Remember, exercising only inflames your body, so that means it works your immune system to come and repair those little tears in your muscle and everything. So exercise, but exercise fast and efficiently for 15 minutes in the morning, and that's it. Exercising is actually not that good right now. It is okay, but remember, it does have an effect on your immune system to a point where you don't want your immune system to be overworked. So yes, exercise, but don't do more than you would anyways, and definitely don't go to the gym or whatever. Do whatever you can at home. It's fine, guys. It's like people have lived in Gitmo. We can surely be fine staying at our home. Let's not worry and fear about what the economy will be. What we need to fear is that if we do not make this exponential curve into this logistics curve, and we do it here, or if we reopen and this goes back like this, then we start to bend it down, curve, flatten it out. You have to realize that this will take a much longer time to converge back to where y equals 0, and y being a function of basically the healthcare system being free and beds per patient. So since beds are constant, it should have been patients over beds, so that we don't go to infinity. In fact, we go to 0. Because a constant number divided by another constant number can go to 0, but something divided by 0, I think infinity, I don't know. So the thing is, only a very small fraction of delay here, or if we open up and like a little bit later we find out, oh my god, and it like here t triple dash and 3 or 4 or t4 subscript 4 t3, this was t1 t dash and this t double dash. So if we just have this at t dash and t3 and t4, where this curve starts to bend, in here it'll be even longer, that this period will be much longer. So will this. And think about it, there's not that much difference here in terms of time, but that's what exponential curves do. If you had a pool full of the Olympic size pool which you could fill with rubber duckies, right, and you knew that the r naught, or any constant that defines this function of filling up the pool, was some positive number that would fill up the pool in 50 days, that you just knew about this constant, and then this function of filling the pool with the rubber duckies, p of rd, rubber ducks, with the pool of rubber ducks, p, whatever this function is. If it's an unbounded function, this is how an exponential curve will work. On the 48th day, you will only have 1% of the pool filled with ducks. So we could be here and thinking, hey, everything is fine. 49th day, exponential curve's power will take it to 50%, and on the 50th day, the entire pool will be full of rubber ducks. So that's the power of some kind of positive r naught, for example. Let's forget about the mortality rate. Let's forget about the time that it takes from ICU to being discharged. That's a very important time to virologists, to clinicians, to infectious disease experts. So not only that, let's say that's exponential, right? Now let's just think about growth rate where it's somewhat tamer, but yet still appreciate how growth rates really just can blow your mind in terms of how effective they are. What I would like you to do is, if you're sitting at home, think of the fact that you have a 0.1 mm piece of paper and fold it onto itself, right? So just multiply this number by 2, then the new number by 2, by 2, 2. So you're just folding this piece of paper onto itself. Do it like about 40 times, 40 to 42 times, 40 to 45 times. If you do it by around 50 times, here you will 42 times, somewhere here. If you do this 42 times, just 0.1 mm thickness, this is geometric progression. You will have reached the moon in terms of the thickness of this paper. It'll be 340,000 kilometers or whatever it is. The moon has been reached, and if you get to like 50, that'll be like 18 times the distance to the moon, 18 times, and it'll be about a fraction of some sort of like a million kilometers. And now we are 150 million kilometers from the sun. It'll be about a million or so. So we'll be like 1/15 of the 1 over 1/50th of the way to the sun, just by folding this piece of paper 50 times. That's just geometric progression. So think about all we've talked about with exponential, because the exponential just is kind of like everything's fine, boom, everything is overloaded. Forget about the system only concentrating on COVID patients. They won't even be able to do that. And when that happens, there will be more deaths that can be avoided. There will be deaths from other people not being able to access healthcare system. there'll be more infections and a spread of the disease. Our healthcare system, healthcare providers will not have the proper facilities and ability to cope, and their own risk will be higher. So we will eventually just have more people dying, a lot more people dying, versus all of us suffer a little bit. There's one thing to have the economy shut down. There's another thing to have a new shop open because out of the 20 in your local market, 10 of them, their owners and their families suffered huge fatalities, and it's a new person with a new shop. We don't want that, right? We don't want to open the economy like that. So just be reasonable with your line of thought. This is, in fact, if any, the time to be thinking rationally, not being emotional. Yes, people are suffering, man. Like, I hate that. Thing is, when people talk about, hey, no one's saying drive at 5 kilometers per hour. Why can't we just do 40 kilometers per hour and do it that way? Well, what happened to when people were dying of hunger before this outbreak? Why were you not talking about those people then? Right? Why now, when it's affecting your bottom line, that you have this moment of like, holy fuck, how am I gonna make money? Yet you are deferring to basically you're kind of abusing and being not irresponsible, but kind of being exploitative of exploiting this fact that there are people who are suffering more than other people. And this whole thing about driving a car has absolutely, it's just an ad hoc non sequitur argument when it comes to having any kind of relationship with COVID. It just does not compute. This is a outbreak of a new virus where practically right now no human actually has any kind of innate immune system response to it, and the response we do have, it seems to be malfunctioning and filling our lungs with basically deadly liquid that is the reason why we are not able to breathe. So we don't actually die of the disease of the virus, we die of pneumonia, which is caused by our immune system going haywire. That's why you have people in Western countries who get these flu, who get like a bite of bee and get hives all over the place and are lactose intolerant because their immune system is hypersensitive, hyperactive. Trust me, you can get any system of your body, whether it's your nociceptive pain receptors, whether it's nociception or whether it's proprioception or lack thereof. Proprioception is basically being aware of your posture. So we are kind of, when we have, like, say, our hands out. Now, both of these have 4 types of pain receptors, 4 redundant pain receptors. Having broken my back, I know that our body is so sensitive to a slight, stimulus in these redundant, starving for stimulus pain receptors will cause a chain reaction where you will become very sensitized to this pain, and you'll be hurting, your back will be hurting. Well, the same is the case with our immune system. If it does not act properly, it causes pneumonia and other complications. It's just, you're playing dice with a deadly disease, and you want snake eyes. Sorry guys, but in this sort of situation, I'd rather go for the tiger crane move rather than rely on snakes in my karate chops. Because remember, our mission is to send this virus flying